Hello and welcome to this special presentation on how to help bulging, herniated, or degenerative discs without drugs or surgery. And hello there, my name is Dr. Vince Leone, and I run an organization called Specialized Practice, and our members are nationwide, and we have all invested a tremendous amount of time, energy, and resources into specialized equipment and training so that we can deliver outstanding clinical outcomes for these tough conditions. So what are we going to cover today? We're going to go into some quick stats on back pain and then stats on disc conditions, types of disc conditions, symptoms of disc conditions, causes, how to tell the difference, right, between a serious condition like a herniated disc or a bulging disc and then a not as serious like a strained sprain. Then we'll talk about common treatments for disc conditions, and then finally we'll talk about, hey, what do we do that's so different yet effective, because it is non-surgical, FDA cleared, drug-free, and pain-free. So let's dive in here. Quick stats on back pain. Big problem, right? In America, affects over 30 million people. 8 out of 10 Americans will be affected at some point in their life with back pain. It's more common in women than men. 54% of desk workers report back pain. Obviously, sitting all day is terrible for you. They say sitting is the new smoking, right? And then 9 out of 10 patients, this is interesting, 9 out of 10 patients never know the primary cause of their back pain. Now, let's shift focus to disc conditions, okay? So that's generalized back pain. Specifically disc conditions. 80% of patients 60 years and older have some form of DDD, or degenerative disc disease. 10% of patients with disc conditions get surgery, which is obviously risky, and there's a tremendous amount of rehab after. It can take several months to heal. Now with disc conditions, it's more likely for men to experience it than women. And we'll get into why that is shortly. And then 90% of disc bulges occur in the low back. So it's primarily a low back issue. We do get cervical or neck bulges and herniations, but typically it's in the low back, basically because that is at the lower part of the frame, which gets the most stress. So types of disc conditions and their secondary results. So a bulge or herniation. So a bulge is slightly less serious than a herniation. We'll show you a little diagram here in a second, but bulging herniation, a lot of times that will cause sciatica. So the sciatic nerve, largest nerve of the body, exits at the lower part of the spine with L5, but just above the buttocks. But that nerve, that big nerve, comes out there. And it's very, when we have a bulge or herniation there, it can press on that nerve, and then we get pain, numbness, tingling, etc. down the sciatic nerve, which goes into the buttock, down the leg, all the way to the feet. Degenerative disc disease. So degenerative DDD it's in kind of a wear and tear issue, and it's typically in older people, 60 years and older, but essentially the disc becomes desiccated. What that means is it loses water content. So the disc is, when it's healthy, about 85-86% water. Isn't that interesting? So degenerative disc disease is where the disc loses its water content. It starts to shrink, it starts to not get as elastic, and so we get pain from it. Now, facet syndrome a lot of times is secondary to degenerative disc, because what happens is the disc loses its height with degenerative disc. Facet syndrome, those are the joints in the spine that connect each vertebrae to each other, so they kind of grind on each other. That's facet syndrome. It's those joints wearing down. And then finally, pinched nerves. That's kind of a layman's term, it's similar to the sciatica, right? So the bulge or the herniation is going to pinch or press on the nerve. And then again, we can get numbness in the back legs or feet. So symptoms. Well, we kind of talked about these. You're probably familiar with them if you're watching this, right? Pain, of course, that can be sharp or dull. Typically, it's more sharp though, with a bulge or herniation. Numbness. This a lot of times is a little more advanced, right? So if we have numbness, right, in the leg or the feet, there's most likely been pressure on that nerve root for quite some time. It's affecting the information that's would normally travel down the nerve root, right? Cramping, is obviously in the muscles, and the reason why we get cramping is because the pressure on the nerve is not, it's basically making the blood flow irregular, right? So in other words, the muscles are not getting their normal blood flow. Blood is food to muscles, and it cramps. It's your body's just talking to you, saying, hey, I'm not getting blood flow here. Tingling, again, pressure on the nerve root. Weakness, the weakness, if you get weakness in your leg, a lot of times patients will trip, catch their toe, sometimes even fall because of weakness in the legs. That's, again, more advanced because the blood flow to the legs and the muscle, it's been going on for a long time. Muscles are starting to get weaker. You may even see atrophy in like your calf or in the upper part of the leg. So that's again, that's a serious side effect, because one of the primary causes of hospitalizations in the elderly are falls and hip fractures. Burning, we can have a burning feeling, aching, we can have that as well. Now, what causes disc conditions? Well, car accident, trauma basically, right? So car accidents, work injuries, weekend warrior incidents, right? So car accidents, when those two vehicles or whatever, multiple vehicles bang into each other, I mean, we're just a fraction of the weight. So we just get tossed around. The seatbelt obviously saves us, but we get a whipping motion, right? And so that whipping motion in the cervical, the neck area, or in the lumbar, the low back, that whipping motion, it causes compression on the disc, right? So it bulges or it herniates, which again, herniation is where it pushes out from the outer, what's called you have the inner part of the disc called the nucleus pulposus, and the outer rim. It actually literally bulges out or herniates out from there. Not good. Work injuries, slips, falls, lifting stuff that's way too heavy. You hear a pop. And then weekend warrior, sometimes it's guys who like to go out, play football, or softball, or whatever it may be, and we just overdo it and push our body past its normal limits. Okay, how do we tell the difference between a disc condition and a sprain strain? So a sprain strain, very common, and that's literally muscle tearing, and there's different grades of it, 1, 2, 3. It's important. Now, we don't want you to self-diagnose. Don't get me wrong here, but it's good information so that you have an idea. Sprain strain is typically local. In other words, it's not traveling down the leg, whereas a disc condition, it usually does travel down the leg. Chronic. So typically we classify chronic about 8 weeks and greater. So in other words, if you have a sprain strain, it will usually resolve in 4 to 6 weeks, and you can usually accelerate that with chiropractic care or physical therapy or massage. But if it sticks around and you've tried, pain medications, and you've been to the chiropractor, been to the PT, and it's still there, a lot of times that's a disc condition. And again, not resolved by other therapies. It's high on the pain scale. A lot of times it'll be like a 7, an 8, a 9. I mean, it's really up there, right? That's kind of a red flag for a disc condition. Doesn't mean it can't be with the sprain strain, just not as common with the sprain strain. And then it affects activities of daily living, right? So it's chronic. You've had this for months, 3 months, 6 months, 3 years. And now, it's tough to mow the lawn, or, go get the mail, or take the dog for a walk, or, vacuum in the house. Those activities are difficult for you. That's a red flag for a disc condition. Okay, now if you go to your medical doctor and you say, and they find out, they order an MRI and they find out that you have a disc condition, bulging or herniated disc, usually they'll start with PT, but in our experience, PT chiropractic just is not super effective for a disc condition. Very good for those other things like sprain, strain, etc. But for a disc condition, if you go to your medical doctor, first treatment, conservative treatment will be go to a PT. But if that does not resolve at the physical therapist, then the next stop is usually a surgical consult, right? So they're going to try drugs, they're going to try surgery. But what do we do that's so different yet so effective? Maybe you heard of it, maybe you haven't. But it is called spinal decompression therapy. And essentially what it is it, you've probably all heard of traction, but there's a big difference between the two. But it's motorized traction. What that means is traditional traction is going to pull and hold, but spinal decompression is going to pull and release, pull and release, pull and release multiple times over the course of care. So this is what I was talking about here. So this is the nucleus pulposus, and this is the outer, essentially, rim, and you can see it has herniated out past that rim, putting pressure on that nerve. That's when we get those symptoms. Now again, the disc, when it's healthy, is 85% water, 86% water. And what happens is when the bulge or herniation happens, it's going to push out and it decreases in height, right? So we're losing water content. Now you can think of the water pressure, which gives the disc its strength, kind of like the air pressure in your tires. So just imagine, say your front left tire should be at 40 psi, but it's at 20 psi. So it's half as tall, half as strong, and you're like driving down the highway at 65 miles per hour. Well, that's not a recipe for success, right? I mean, it's gonna, not gonna probably go straight. It's probably gonna pull to the side. People are probably gonna be yelling at you, all this type of stuff. But same thing, what we walk around and we work and we do daily activities as much as we can with the disc condition. It's kind of like driving down the highway with that tire at 20 psi. So that's spinal decompression, and that's what we do if the patient qualifies. So let's take a quick look at this video here so you can see a visual demonstration of it. As we pop in here, so there's the disc, that's the issue. The decompression is going to pull and release, pull and release. You can see the bulge or herniation right here. It's putting pressure on the nerve root there, and now water is going back in the disc. This is actually the spinal cord. Usually it bulges out to the side, but that's just kind of a quick little visual demonstration of spinal decompression therapy. Now, is it safe? Absolutely. It's FDA cleared, and it has been for many, many years. Very gentle. Patients usually actually fall asleep. It's typically the first time they've been out of pain, right? So in a long time, and you just lay on the table. Again, it's going to pull and release, very gentle, and it's not pulling a ton, right? I mean, it's minimal, but it's just what the disc needs to create a negative pressure in the middle of the disc so it can absorb water from the body, right? Now, a lot of people say, well, should I just drink more water? Will my disc be healed? No. You can drink more water. It's good for you. But without that negative pressure in the middle of the disc, it's not going to have that ability to absorb water from the body. So, and we have tremendous research that backs up this therapy. Okay, now, next question patients usually have is, hey, is it covered by my insurance? And look, I pay a lot for insurance, and I'm sure you do too, but here's the thing. Insurance is considering this, by and large, and when I say that, I mean most insurances are considered this elective, like LASIK. They're not saying it doesn't work, they just say we're not paying for it. Well, go figure. They don't pay for a lot of stuff. But if it is not covered, how much is it? It ranges, of course, because every office is different across the United States, but typically it's going to be $75 to $125 per visit, and the number of visits depends on the severity of the condition. So this is why we need the evaluation, right? So let's take a look. What did we cover today? By the way, you know more about disc conditions and back conditions than probably 90% of the population now. So aren't you happy about that? But this is great information. The more you know about your body, the better decisions you can make to get, to improve yourself for the future. It's super important. So what did we cover? We talked about stats on back pain, stats on disc conditions, types of disc conditions, symptoms of disc conditions, causes, how to tell if it's a disc condition, or maybe it's just a sprain strain, common treatments for disc conditions, which is typically from the MD to the PT. If that doesn't work, drugs and surgery. And what we do that's so different yet so effective, which is spinal decompression therapy. So how do we determine if you're a good candidate? Well, of course, you're going to come into one of our offices. We're going to do a health history, a thorough health history. We're going to do a thorough exam. It's going to be an orthopedic and a neurological exam. We're going to need some imaging, okay? Either x-ray or an MRI. And by the way, if you have some recent imaging, definitely bring it in with you. and then we'll give you our recommended care. We'll let you know if you're a candidate, and then if so, what the recommendations are moving forward. So what to do now if you're watching this and you're like, hey, this is interesting and I may have a disc condition. Well, the great news is if you're watching this, you have a specialist in your area, and that is Dr. April Shook at Gulf Coast Functional Pain Relief, and their phone number is 727-490-6011, and they have an excellent new patient special. It includes a consultation, an examination, a report of findings, and a first trial treatment for just $85. So I would highly encourage you, if this is something that you're suffering from and you want to see if spinal decompression can help you, call Dr. Shook's office today at 727-490-6011. Don't suffer in silence. Find out if spinal decompression can help you. So that's it for this special presentation. Thank you so much for your time and attention today. My name is Dr. Vince Leone, and I wish you the best in health.